Welcome to Sniff This, the podcast where we pull back the bed sheets on skilled nursing facilities, educating, entertaining, and occasionally risking being reported to HR. Awesome. I'm really excited about today's episode. I'm joined with two of my great friends here, Tennille Smith and Emily Durbin, who combined have like 40 years.
That would ages us. No, it's like
40 years of experience in the industry. I'm your host, Chance. I was a skilled nursing facility administrator, tried to run away from the industry and then went to PA school. And got sucked right back in, and happy to be here. But today we're going to talk about some of the basic things of being in the industry, some of the highlights, the low points, and maybe some funny things in between. But as you buckle up today, we're going to talk about acronyms of DON, BOM. What does the administrator do? What is the medical director? How do they help? What's their process in that? If you're already familiar with all those, this is going to be, maybe you can use your orientation binder as a door stopper, but not in a med safety survey. So we'll talk about some of those things. So it's my pleasure, like I said, to introduce Tennille and Emily. Very excited to have them. They've been through it all, I would say, from the nursing notes on the napkins, the ever-changing administrator that comes every couple of years, survey, which we're going to talk about today, which is the worst thing in the industry.
Yep.
And probably and the dietary choices that really make Taco Tuesday look like Whole30. We'll talk about that. So really, on a serious note, I think their leadership and impact in the industry has been huge. So feel very lucky to have them joining us today. So one of the things we talk about, especially as we talk about the industry, is the crazy amount of acronyms in the industry. And I think if you're not working in the industry, it's really difficult to kind of jump in and understand what those even mean, especially as we bring new people into the industry. So talk me through some of these acronyms that we have, and I think most basic, what does SNF mean?
Do you want it to you? SNF, Skilled Nursing Facility.
Okay. And our podcast, Sniff This, so that plays into that. And then you're joining us today in the break room, which also is an important part of our discussion today. But so then I say DON, what does that mean?
Director of Nursing.
Okay, what's their job?
Like everything nursing. I mean, they're over all of the nurses, over the CNAs, they, all the, the regulations. I mean, their list is endless as far as
the hardest job in the building.
It really is. They
hands
do
down.
Everything.
Yeah, I think DON probably is the hardest job. I always, as an administrator, I think you were probably only as good as your director of nursing.
For sure.
And I think they make the administrator look good.
Yep.
So not to downplay the administrator, because I was that, but we all know the DONs. And I think that plays into a lot of the turnover we get.
Right. But a fabulous facility is actually top down. So if you have a fabulous administrator and then a great DON,
you're right.
It affects the whole building. But you can have a crappy administrator and a phenomenal DON, but really not the opposite, and have a successful building.
Interesting. Yeah. I think there's a lot of nuances. If you're talking about the management team, who's the management team in a nursing facility?
Department heads. I think that was the term we used a lot. Yeah. Department heads. So
so you've got your physical therapist, right? Your DON. You've got your
ADON.
Yeah, your social worker.
So you're saying a lot of acronyms.
Okay.
So ADON, what's ADON?
Assistant Director of Nursing.
Yeah.
Okay.
And then you've got staff developer.
What do they do?
They'll be in charge of your CNAs, your staffing of your CNAs.
Okay.
Let's see.
Social worker.
Okay.
Definitely social worker.
You gotta have a business.
Recreation.
What
Recreation's a big deal.
What does recreation do?
They do all the fun, all the activities in the building. But the department head team is like a cohesive team that all works together to make the facility successed. You also have a dietary manager.
I was gonna say, don't forget the kitchen.
You've got central supply. Yeah. If you don't have your supplies that you need, that's not working.
How'd you forget about maintenance?
Maintenance. We definitely have maintenance. He just says that because I married one.
Yeah.
But
I gotta throw in medical records. They gotta be there.
Absolutely.
Medical records. Yeah. So there's a huge department head team.
Yeah.
And everybody plays their key part for it, or the facility's not successful.
Yeah.
Takes a huge team really to run a nursing facility.
Oh, yeah. Oh, then you got billing and HR.
Business management. I didn't
yeah.
say HR. Yeah,
There's a lot.
There's a lot.
Yeah, I think is like from the outside looking in, like a typical stereotypical like nursing home like probably has a lot of stereotypes around it.
Yeah.
But I think the interesting thing for me is like from a nursing home perspective, it's its own little world, like its own little culture.
Yep.
And it like runs really interesting. So
because within its own little culture, then you have like your own little cultures of you got the PT bros down the hall.
Yeah.
They're a totally different culture than your nurses and your kitchen.
Yeah.
Like, so even within that, then you have little communities that kind of function on their own, but also have to function as a team also.
Definitely.
interesting. Okay. So talk to me when someone says admin, who's that? What's their job? You talked about like a good or bad, like how does that play into it?
So administrator.
Like what do they even do? They just sit in their office and
Some do.
Some.
Some do.
Yeah, absolutely.
Some I couldn't tell you what they did, and some I would say were the backbone of the building that knew everything that was happening in every department at all times and knew our patients and knew their families. I would say they're a big problem solver to me. I know this isn't like their actual job. I know there's like much more behind their job, but I also feel like they were a really big problem solver when those frustrated family members came in. I felt like the admin could like see, hear them, be a voice if they were good. Again, I've worked with plenty who weren't, but I feel like they were the ones that got the problems a lot. I don't know. That's just,
No, I agree.
Yeah.
If you had the ones that came out of the office.
Yeah. So there's very much a this or that.
Yeah.
There's not a lot of in between.
Okay, so let's talk about this like unknown person. Not a lot of people in the facility know who it is, but the medical director.
Okay.
Like, what's the role of the medical director, maybe as it used to be, and how it's kind of morphing into being more involved in the industry today?
To me, like what it, I don't know, used to be, I guess is what I'll start with is like, I felt like, obviously, I say obviously, maybe not so obviously, but like a doctor, MD type of person that oversaw all the medical care of the facility. But to me, it used to be like this person that came in at 7 a.m. and snuck out by 9 a.m. that like patients didn't really see or know or really have a connection to, but they signed the orders. They gave us what the nurses need. I don't know. To me, it was like a person in the night that came and we didn't really see or know.
Yeah.
And it depends, because then there was times that we had, again, phenomenal
You're right.
medical directors that would come in and were really engaging and would go see the patients. And even if we had new ones pop up on the list, they were happy to go down to the room and address the issue. So again, it's the same with the administrator. Yeah. It can make or break the building. There's awesome ones, and then there's plenty of examples of not so awesome ones.
Yeah.
So
I think overall, like, the perspective for me has changed and been super interesting, because before I think it was like a marketing ploy. So we're going to get the local doctor or local ortho surgeon to be our medical director, who really knows nothing about geriatric care, doesn't want to be involved, but wants to get that kind of monthly stipend.
And like, again, just comes in, kind of writes a couple of scripts and like out the door. Who does like?
Yeah,
that's my
Where it's morphed now, and I think a lot of the regulatory changes are going towards like requiring the medical director to be really involved in the day-to-day sort of process and improvements. And so I think we're starting to see a really big shift in the involvement of the medical director.
Which is such a great thing for those patients that deserve that care, that deserve somebody who is engaged with their medical care.
Some of the buildings have like daily rounds, I understand, with medical directors now, where before it was like once a week for 2 hours. Yeah. And now they're having them come in and actually spend a chunk of time every single day. Yeah, which is a huge benefit to the patients and the facility.
Yeah, I think the hard part for a medical director, though, and I think a lot of people probably don't understand this overall, is that by them signing up to be the medical director, they're on call 24/7. So day, nights, weekends, holiday. And as you look at some of the like trends that are happening in the industry, it's really hard to attract a provider or medical director to work in this industry. And for sure. I think part of it is like, it's not a sexy like position, right? And no one wants to be on call all night, every day.
And it's a lot of calls. It's not like your occasional calls. It's a lot of calls every night, that they need help, So It's not a sexy job, no. It's not.
One of the things I always get questions about is like, why is the nurse calling me about this? Or like they refused their Tums or they fell, they're not hurt at all. Like, why am I getting a call from the medical director perspective? Why are the nurses calling for that?
Isn't that just regulations for the facility? Like they have to notify within a certain amount of time.
Yeah.
There's so many of those rules that they're bound by. Again, with your state survey and all of that. So.
Oh, let's not talk about
survey. The worst week of the entire year.
We'll get into survey in just a second. But like maybe talk me through what is the process for a nurse to get a hold of a medical director? Say it's 2 a.m. in the morning from the traditional sense. Like what
it's a phone
is
call.
the process?
Or a text,
right?
Like when that became kind of a thing back in the day, pagers, you know.
Yep.
Pagers? What is that?
Don't say pagers. I had a sweet pager at my first building.
But like back in the day, I had a nurse that had a pager for far too long. But anyway, but then they would like, you know, a text or a phone call of like, hey, this happened. And typically that provider is not thrilled at 2 a.m. to be taking a phone call. And sometimes they make the nurse feel insignificant or like it wasn't important. But let's say you have a brand new LPN that's out there, you know.
What's an LPN?
Oh gosh.
Licensed practitioner nurse. Practitioner?
Yeah, practitioner.
Close. I think it's practical.
What practical? Yeah, that's what we said.
Which they don't operate in like an acute setting. That's really unique to the industry. It's like an LPN.
Yeah.
And we use that kind of colloquially a little bit, like an LPN's taking the call. But like, what's the difference between an LPN and an RN? And why would that make a difference from like a medical director who's talking to an LPN versus an RN?
Just their level of schooling and education and what they've been through. So I don't know currently what the LPN program is.
I think it's a year, 15 months, something like that.
It's a lot less than the RN.
It is a lot less.
Yeah. So like if you're talking to an LPN too, and you want, say, an IV, some like state regulatory environments don't even allow a LPN to start an IV, to give fluids, to like do push like injection medications. And so they may even be the only nurse that's on at night, which is like really important part of understanding, I think, the SNF world is the staffing of nurses. So like talk to me about like nurse staffing ratios. Talk to me about the job of a nurse in a nursing facility.
So hard.
Honestly,
hard.
Just the most overworked, underpaid people who give their heart and their soul to other people. They really do. They always have too many patients, right? They always have
like put a number to it.
I don't even know what it is anymore.
I don't know a great number, but I would say, I mean, in the middle of the night, a nurse would easily have 25 to 30 patients, right?
Yeah, sometimes
easily.
40.
I was gonna say that's pretty low, right?
Especially like on a graveyard shift or night shift. There's like one nurse on the whole building.
Almost always, at least once or twice a week, your CNA didn't show up. So
always
you're down a CNA. Yep. So people need to be toileted. They need to get up in the middle of the night. They threw up. All the things. They fall.
That's if they made it to the toilet.
Well, that's I mean all of it, and they need that care. And so the nurse is trying to manage 40 people. She had 2 CNAs. Let's say one of the CNAs doesn't show up. So when people have to go to the bathroom, she jumps in and is helping those CNAs, and she's covering and she's doing things that aren't her job or in her job description. Mm-hmm. But when you have people who have such acute needs, right, then you just do it, right? And that means that then you're late on your med pass, and then you're scrambled, and then you make med errors.
Like, what is med pass? Like, we talk about, like, the providers talk to the nurse, and the nurse is like, I'm right in the middle of med pass, and they're kind of frustrated when they're talking to a provider. Like, why? Like, what's going on?
You have 40 people who want their meds right then. They all have a med that's supposed to be given at bedtime. And it's bedtime, and they all want their nurse right now.
Or pain meds, or... Yeah. And most of them don't just have 1 or 2 medications. We're talking about typically geriatric patients that have dozens of medications. And so the nurses pop in the bubble packs to go through all the medication lists that they have at that time and how much they need. But there's also time frames that those medications need to be given to each patient. So if they're not getting through the hallway to each of the patients, they're already backed up, and patients aren't getting their meds on time.
And especially in a skilled nursing facility, these people just came from their homes. They had something that now has removed them from their home.
Right.
But they want their medications at 8 o'clock when they normally take them. Mm-hmm. And that's something that they want to control. And then all of a sudden, it's out of their control. And so they become impatient, and they become people who I don't feel like they normally are, but they get impatient because now we've taken away the control of their lives. Yeah. And those nurses feel the brunt of that.
Or if they're in pain, right?
Yeah.
We're all worse when we're hurting.
Yeah.
When there's pain. So.
Yeah. So I think the other aspect of it, in a lot of ways, it's turned into like a customer service like position and role.
Yeah.
And if they don't pass the meds within a certain amount of time, they actually get in trouble for it. Yeah. Both from their DON and ADON, but also from a regulatory standpoint. Yeah. We'll talk about survey comes in and then says, why did you administer this medication late? And then you had 3, no joke, patients on the floor.
Yeah, absolutely.
4 that like went to the bathroom in their bed.
Yeah.
And then another 10 who've like pressed their call late and are wanting to go to the bathroom. And that. So I think one thing to understand really holistically about a skilled nursing facility is the role of the nurse and really how difficult that job is.
Yeah, absolutely.
And so as they're reaching out to a provider, they're already stressed the max.
Oh, absolutely.
They have no time.
No. And just the industry normal has been that they might get a little bit of, I don't want to say, they might not be treated great in that moment when they call. They might be told like, why are you calling? So I think they're questioning their judgment call also. Like, do I need to call somebody? Do I have to? You know, because they don't want to be treated like crap either. You know?
Yeah. And I think typically in the industry, it, for a lot of them, it's like a stepping stone to then get to the hospital or an acute care setting or like go on to like further their education, especially CNAs and nurses. So we oftentimes see even like within a quarter, like 100% turnover of nurses in a facility. So who don't know the patients, don't know the process, don't know really. And then they're reaching out to a provider for help and the provider's leaning on them for help. And then they're kind of both stuck in a position where it's like there's a lot of frustration on both ends of it. So I think the other probably stress thing we do for our providers is to make sure that they understand the role of the nurse and really how difficult that is. I think a lot of times I get questions of like, why are there so many medication errors? It's kind of scary, right? On the outside, if you're outside looking in. But like, if you understand really the role of the nurse and like how busy and how overworked they are, then like, you kind of understand that. Not uncommon for a nurse in the middle of their shift just to leave and quit their job. Or a CNA just to walk away. So huge nod to like nurses and CNAs who are working in the, really the backbone of what we're doing.
They are.
Yes.
One thing that I think is important in a nursing home setting, and we call it skilled nursing facility, is like, what's the difference between like a skilled patient as we define it and a long-term care patient?
Let me go.
So skilled is typically they've had a 3-day hospital stay, acute stay, and then they're transferred to a skilled nursing facility, and they can utilize their Medicare or their rehab benefits. That's typically a 100-day benefit, as long as they meet criteria under therapy and nursing things. So that would be more your skilled patient. Skilled will also, you can, from my understanding, do certain IV antibiotics or wound care can also qualify for skilled. And then your long-term is patients that are more or less live there long-term. It's more like a nursing home patient that have chronic long-term needs. And that's become more like a permanent placement for them where they live.
Yeah, I think the other, overall interesting trend in the industry is that sicker patients are coming out of the hospital sooner. So they're starting to call these like nursing home SNFs like these med surg units. So like as insurance is like pushed towards the trend to get them out of the hospital because it's so expensive to be in the hospital. These patients are getting discharged out of the hospital sooner and sooner with higher complications, higher disease process, longer, more difficult like patients. And then you add that already to the nursing load of the nurse, like this is like a huge problem in the industry because there's patients are getting sicker, they're coming out of the hospital sooner, and they only get so many days that are covered because even after 20 days they have to start paying a copay daily in the hundreds of dollars,
and
that's so even with
expensive.
Medicare,
right? That's what I was gonna say. And some of the insurances are like wanting to get them out sooner than that, forcing that out a little bit more.
So talk to me about like the admissions process and why there's so much frustration from a patient coming to the hospital to a skilled nursing facility, and why is that like frustration getting passed on to like the providers, and like what's happening in that scenario? And it's always Friday
I was
at
just going to say,
5:30,
first
right?
off, it's always Friday at 5. Like,
Right.
that's just always when the hospital calls. And as an admissions person, you want that admit. You're ready for it. Your
Sure.
job depends upon those admits. So you have this moment to assess and like, can our building handle this type of thing, right? So you're moving on it of like, yeah. But I think that oftentimes they don't come with everything that they need because, again, the hospital's rushing them to get out the door. Admissions is like, yeah, we need census. We want that. And so they bring them in, and you don't have your regular nurses there because they've already left for the day, right?
Right.
That's just what
all the
it is.
managers are gone.
They're gone. And
Yeah.
so you now have, you know, a nurse on the floor that is trying to go through all of the orders, and the hospital didn't send all of the medications or even the right orders. And the patient's now sitting there going, I'm in
or
pain.
the prescription
The
for it.
narcotic, the script. That's as I
I'm
mentioned.
in pain.
Yep.
And they didn't send anything, like, you know, and so that patient is then, I mean, they've come over, somebody came and picked him up and, you know, dropped him off in an unfamiliar place that they don't really
know
want to
anyone.
be there either. So they're already, I don't care who you are. I think on an admit, you're a little irritated.
Sure. It's no place is like home, right?
Yeah.
Everyone just wants to go home.
Yeah.
And it's not a safe discharge. And so they get sent to a
Yeah.
skilled
Yeah.
facility, and
All of them
they don't want
wanna
to
go
be
home.
there.
They don't want to be at the
They,
hospital.
they don't want to be
Yeah.
there.
And now
so,
you're stuck at a facility you don't know a single person.
yeah.
Where you've got to
And-
know some nurses at the hospital or your aides, and you're a little
Yeah.
comfortable.
But you
And
also
everything's new and
had
scary.
at the hospital, you had one nurse taking care of 5 patients,
Absolutely.
right?
Yep, absolutely.
And now they're not any like there's not a ton of improvement from them coming out of the hospital. And now you have one nurse maybe during the day, like taking care of 12, 15, sometimes 20.
Right.
And then you do a night shift and one nurse is taking care of
Yep.
40 patients.
Exactly.
And so it's a very like that first 72 hours of transition out of the hospital is really difficult, especially for the nurses. And those are a lot
And
of
the
the ones
patient,
that they're like
right?
reaching out, and the patient too, and their
Right.
families.
Right. Yeah.
Because they have no expectation of what happens in a nursing home.
No.
Like now you don't have a provider or a doctor who's around the clock
No, or
in a
who's doing
nursing
rounds
home.
on you like that weekend. Like,
Yeah.
no one's coming to see.
And a nurse can't even give you Tylenol without an order.
No, they can't
No.
do anything.
And
as
so
far
like
as
a
that.
lot of times their hands are tied. So maybe switching gears a little bit. I think we got a little deep on the nursing side.
I know.
But like hats off really to the nursing side.
Absolutely.
But let's go to another exciting topic and talk about survey. Why what does survey mean, and why is this such like a
Like fear and panic is what it
into
means.
this, and like talk about maybe how providers can kind of help during this process and what they're doing.
It is
So,
hands down the worst week of all the facility, but mostly department heads' lives.
yeah.
It is
So what's happening?
brutal.
Like, tell
so
me what a survey
the state has
is.
sent in representatives from
The state.
what is the
Medicare.
state, but what is it?
Yep.
Medicare, Medicaid.
Yep. CMS.
A CMS. Yep. And they come in and they audit your whole facility. So they look at everything, every department. Of course, your biggest things are going to be nursing, but they're even looking at maintenance, and they're looking at the kitchen, and I mean, just
Recreation.
everything, housekeeping
Yeah, they
and
do.
chemicals. And so everybody is on the highest level of anxiety and stress you can even imagine. Because no matter what, no matter how phenomenal a building is, a surveyor, and it's not just one, a survey team shows up. So you have this group of people that are more or less experts in their field that come in and are going to start digging and looking into everything in the facility to find any fault whatsoever. And the best facility, you could find something.
You always do.
You always could find something.
Yeah.
Even minor things.
Yeah. The survey process is every facility yearly has to go through this recertification process to be approved by Medicare and Medicaid and other insurances as they follow Medicare sort of guidance. And so they come in, they really dig through everything. So they're looking at every patient chart. They're looking at those missed medications that we talked about. They interview the patients, and the patients have a say on like, are you happy here? Do they take care of you? And if that morning their breakfast was cold, which for heaven's sakes during a survey would be horrible,
But it
then they're going to
happens.
complain about it.
Right.
And that sends them into this like deep, dark abyss of like really digging through stuff. And so
Right.
from a nursing and like facility management perspective, it's the most stressful part of the year.
Yeah.
Absolutely.
Many times sleepless nights and trying to fix things and get it. And so oftentimes a nurse is trying to reach out to a medical director for a signature because they know a survey is like looking at it closely and they can't get a hold of a medical director. And so like providers being on call and being responsive really help out in this process.
The other thing,
Definitely.
if you're not in the industry that you don't know, we don't know when they're going to show up.
Oh, no.
We have no idea. Like our Don was gone, if you recall, one time.
Oh yeah, he was deployed.
He was deployed. Like he was nowhere near when survey shows up, and they always somehow show up on those moments when an
that should be
admin's gone
illegal.
or a Don's gone. We have no warning, and so it's just like, how do we get ready for this right here? Why they're here?
Yeah.
And yeah, it's,
I'm like my stomach's like.
me too.
turning,
I'm like,
thinking about survey,
yeah.
and that text that goes out that state is here is
It's the worst.
it is the worst.
and some of the percentage of them have to be in the middle of the night, so they'll show up
yeah.
in the middle of the night.
Yeah,
and
no
you're like-
warning.
it's like horrible. So, given all sort of what we talked about today, what kept you in the industry so long? Why have you guys stayed? Like, why do you run?
Oh,
A lot of reasons.
that is a deep,
Oh my
deep
goodness, it's deep. I'm like, that's deep.
Masochist.
I love the geriatric population. First off, they have my heart. I love them, and I've always stayed because they deserved good care, and they deserved a good friend, and they deserved somebody on their really bad day. For me personally, I was really helped by a healthcare professional years and years ago, and she changed my life, and I wanted to be somebody there on somebody's worst day, and that's why I stayed.
It's awesome. You're great at it too.
I know.
Tennille?
I don't know about that, but
I don't know. Like I think about it. I've actually thought about it for years. And it was supposed to be just a stepping stone. Like it was just, I was 18 when I first started at the first sniff. And I just thought, I was in the middle of just starting school, right out of high school. And it just kind of sucked me in. Like I just thought, well, I'll do it another 6 months or I'll do it another year. And before long it was, I've been here 2 years and then 4 years and then 10 years and then
we just said
16 years. Yeah,
Tennille actually trained me in the industry. She was my first job. Like,
that's
she was
another
my
whole-
boss lady.
That was another whole story. Oh my gosh. But there's so many amazing people, even through your lifetime, that have become just cherished friends throughout the years. And our facility became a family, and we were so close and so intertwined in each other's lives. And then we start getting married and we're dating coworkers, and there were several marriages that happened. I did.
Sketchy.
I know, I did. That's all right. He went back and got his doctorate, so we're okay. But yeah, it's just, I don't know. It was home. It's where I felt the most comfortable, and it's the people, not just even the colleagues and coworkers that I have and the longtime friendships I have, but the patients, the ones that would meet me at my office door and want to sit in a chair in the office. And she didn't really talk a whole lot, but she just sat there because she wanted to be right there. And I don't know, just people that have kind of imprinted on your soul. And that's what kept me there.
I will say too, there is no 2 days that are alike.
Never.
And I think that's part of what kept me there too.
Yeah.
It's like I liked walking into the unknown because you just didn't know who was going to beat the crap out of you or who was going to be your best friend.
Absolutely.
Like it just kind of depended.
It could be the same patient on a different day.
Yeah, absolutely.
Right?
So I think that was kind of exciting to me. I'm not going to lie. I loved that. Just it seemed boring to me to do other jobs that just you do the same thing every day.
Yeah.
And that you always have different coworkers, different patients all the time was fun. I love it.
I think the biggest takeaway for me is like from people who are looking from the outside in, like these people really care about the patients they take care of. And they get to know them. And I loved the sort of retrospectively look as they like talk about their lives and they talk about the things they've done. And you have like doctors who like when they were young would like deliver babies in their like living room and that because they were the local doctor and the only access they had of like these really cool like military veterans who would talk about like being deployed and kind of what that takes, and then they really become like family. And so I always try to stress with providers, probably the best thing you can do from a provider perspective is like trust the nurse in what they're worried about. If they're worried about this patient, they know this patient, they've taken care of them for a long time. If they've been around for a long time, the lucky ones.
Yeah.
Right.
And they really know some of those changing conditions. And I often ask the nurses who are calling in, say, hey, what do you think? Like, what worked last time? What do you think about? And then, so I think it provides like an interesting, as you're stepping into this weird, like sort of culture of people that like, depend on each other, from coworkers to patients. And it's really like this really cool ecosystem that but is so hard.
Yeah.
Like I don't know any other industry that's like as difficult.
I
as
agree.
This.
I'll agree.
And it takes a special person to want to do it. It's especially with the nursing. Like you could go do anything. You could go to a clinic and work a 9 to 5. You go to the hospital. Like there's so many different opportunities that you can do, and skilled nursing is so difficult.
Yeah.
It is so difficult and so challenging.
So a little bit of a pivot here. Like any funny stories from like working in the industry?
Oh my God.
Any that like come to mind right away? I'll start off because I was knowing I was going to ask this question, maybe a little unfair for you guys, but we were in the middle of survey. Again, the worst time of the year. And I was in this 3-story building, rundown building, like 2 weeks before the furnace had exploded, literally filled the whole building with smoke. And we had to tear out some of the walls and some of the ceiling. And then, of course, survey showed up right in the middle of all this. Like someone probably tipped them off. But your competitor down the road is like competing for that dang patient to come. Right. So then we had this like laundry chute where you would.
I don't even
Have I told you this story? Okay, there's this laundry chute where like, so you would drop all the laundry and it would drop down into the grungy laundry room.
Yeah.
Right? With the like machine that's been there for probably 100 years.
Oh yeah, for
like,
sure.
overall. But like, so I'm walking around like trying to like manage the survey process and keeping an eye what are the surveyors looking at, and like, oh, they're looking in like this patient's room, and making sure we're trying to anticipate what they're going to ask. And I hear this screaming like, help, help. So like I already start panicking and I run down the hall, and this poor lady, she had put her clothes in this laundry chute and then forgot she had something in her pocket.
Probably your teeth. Sorry, I've done that too many times.
Let's just might have been something in her pocket, and she thought if she like leaned over and down that she could get this out of her clothes. And she tipped over into the laundry chute, and literally her legs are hanging out, and she's screaming for help.
My goodness.
And like, I know there's a surveyor around the corner, so I run and like pull her out of the laundry chute. Good thing she didn't go down the laundry chute.
Yeah.
Stop laughing. But then like a surveyor walks up and is like, is everything okay? And I'm like, yeah, everything's great. Like totally fine. So like this other time, like 3 a.m, I remember this, like I got a call from the Nevada State Highway Patrol, and they're like, is so-and-so a patient at your facility? And I was like, yeah. Well, we just pulled her over. She's going 20 on the freeway. She was driving to Mesquite because she wanted to get some cigarettes. Awesome. Turns out she stole the nurse's van. Of course. Because the keys were out on the nurse's station. And
of course they were.
But it was only going 20 because the transmission was broke. So she was in first gear the whole time. So I think there's also some really funny, like hilarious things that happen in a nursing home that like make it fun. Any other thoughts or stories that popped to your mind?
Oh, bad ones. I can't share most of mine.
Keep that in yourself, Tennille.
The same thing.
There's a lot of stories.
Yeah, I'm gonna say that too. Just good.
Don't want to share any of them?
Everything I'm like coming to is not probably the most appropriate. I'm sure.
Okay, well, we'll skip that then because we don't want to get too much trouble today. But we'll transition to one of my favorite parts of the segment, because our podcast is Sniff This.
Yeah.
So like I'm gonna have you sniff
No.
this. So these are common smells
What are we doing?
in a nurse's break room or in a nursing home.
This is not anything I want to smell.
Yeah. So I'm gonna have you smell them. Like both of you can smell. Like pass it to each other and try to guess what the smell is.
You start first.
No.
Okay, you go first, and then I'll do the next one.
I'm leaning to the microphone. That's not gonna help me.
I don't know. That's like lemon.
It's a cleaner of some sort.
I don't think there's any lemon.
Cleaner, but like it's a clean.
I don't know.
It's not like the white.
Maybe I've ruined my smeller.
Smell. What do you smell?
You probably ruined it. Too many years of it. You can tell.
Miralax.
Miralax.
Still softener. Yeah.
Oh.
Okay, I got it. You gotta add some prune juice to it though, buddy.
Yeah. I
Okay,
should have said a brown cow. We would have known
brown
that.
cow. I could have done that for sure. Oh, I don't know.
That's a cleaner. That's a soap.
I know,
Isn't it?
It's not like
Why do I think everything's
think
soap?
wound care.
Oh, it's wound care.
Antiseptic?
So chlorhexidine.
Yeah.
It's the pink. It's a dead giveaway.
Totally clean.
It's like a dead giveaway.
I know.
Okay, next.
Okay.
They better not get
You go
worse.
first.
It's getting better, actually.
Okay,
Go
good.
first.
What?
I know that one
heck?
looks scary.
I don't even want to look at that one.
That's why I'm making
not
you go
sticking my nose on it.
first.
There's like fuzz on it.
Well, I haven't stuck my nose on any of them.
What the crap is that? Is that literally crap? There's literally fuzz on it. Look in there.
It's a cotton ball.
It's growing something. Is
It's
it
a cotton ball.
Here, let me see.
It's
I
a
don't
cotton
believe
ball,
you.
like doused with something.
Okay, it is.
Okay, I feel like I'm getting a headache from the smells.
Can you smell?
No, I feel like I. Like what?
We're failing. Why are you telling us?
terrible.
That's so disappointing.
It is.
Diet Coke.
What?
Oh my gosh.
Even the best one, McDonald's Diet Coke.
I was like, I
Okay,
thought that it
come
was
on.
me
Keep
craving
moving
a
here.
Diet Coke because this is
Yeah, where
too
is
much.
my Diet Coke actually?
Like
Wow,
my brain
that's
is
delicious.
overpowered.
Okay. Yeah, it is.
That's like alcohol.
Oh, I love that smell. Like rubbing alcohol?
Yeah, it's rubbing alcohol, right?
It's rubbing
It's the
alcohol.
purple wipes.
Okay.
Oh, I love that
That'll
smell.
count.
That
That's
smells like
weird.
my
Yeah,
That's
like, I
weird.
like
my
don't
surgeon's
keep
office
sniffing.
when I was a kid. Oh, I
like,
love
I
it.
feel like
Do you
I
have a
have, like,
gasoline
habits
one? That one's a good one. What was this?
I didn't smell it. I need to like clear the palate somehow.
What is that? It's brown.
I can't
like coffee.
Diet Coke in there.
Did you get put in coffee?
Yeah, it is coffee. It's 100%.
It's like a staple in a nursing home.
Yeah, that's not bad.
Good job, guys.
It
That's
just
like the
looks
first one you
creepy.
got.
I mean, first of all,
Last
I
one.
got the purple.
it's
wine.
cotton
Okay.
balls full of stuff, so it looks worse than it really is.
Oh, that is alcohol.
Oh, like real alcohol?
Tennille.
Rubbing alcohol.
Oh, that one's rubbing alcohol too. What was the other one?
Purple white.
That's rubbing
This one's
alcohol.
way better.
Yeah, that's
Okay,
one.
put the lid back on. You're kind of making me nervous. Okay, so as we kind of like wrap this up a little bit, what is like some advice you would give to new people coming in the industry, but mostly
something else.
particular, mostly particular like providers? So MDs, PAs, MPs are coming into the space. They're kind of removed. They're not in kind of the day-to-day of this. They don't see kind of the stressful moments that are happening. And then they get a call from a stressed nurse, just stress out of their mind. Like, what's some advice that you would give to a provider?
Empathy.
Okay.
Yeah, just to have some empathy and just our conversation today that it is such a difficult job. It is so hard, and maybe having a little bit of understanding of what they're walking into or what their baby experience on an everyday basis.
I think along with that, just that level of respect, like you said, that when you talk to the nurses sometimes, to be able to ask them, well, what do you think? Because again, some of these patients, these nurses have known for years and years, and they know that every time this patient gets this is what works. And so to be able to have that level of respect and just talk to her and hear her and see her as a person.
Or him.
Or him. Good call, good call.
We had some awesome male nurses,
my
right?
favorite nurses are male, I will say that. So.
Well, that's a whole different story.
Okay,
Hopefully Chris isn't listening. But before we conclude, just want to give a huge shout out to our sponsor, Vital Care. Whether you're burning the midnight oil or just trying to survive another 2 a.m. call, Vital Care provides on-call medical director support whenever you need it. Nights, weekends, and holidays. With coverage nationwide, they're leading the way in post-acute care, elevating quality, expanding access, and supporting well-being for all. Learn more at vitalcare.org. But thanks for joining us today, my friends, Emily and Tennille. I can't think of anyone else I'd want to be in the trenches with. So thanks for sharing your experience and knowledge. And
thanks for having us.
We'll see if we get approved to have you guys back on the podcast again. Some of the higher ups maybe but it's okay. Really, really grateful for the time you took and the time you've spent in the industry, I know has made a huge impact. So we'll wrap that up for today. Excited for our next episode next week. So take care, guys.
Awesome. Thank you.
Thanks.
Thank you for joining us for this episode of Sniff This. Remember, every DON is a hero, every admin is a magician, and every medical director is just one good joke away from winning staff appreciation. Share this show with your favorite CNA or anyone who's survived an all-staff meeting fueled by cold coffee. Till next time, I'm Chance, and skilled nursing, if you sniff something, say something.